Hi everybody. A caregiver recently asked me, what should I know about all of the terms and the words that doctors and hospitals and nursing homes and insurance companies and other people use when talking about aging and caregiving and care for aging parents. So I came up with a short list of 10 reading terms every caregiver and every aging adult should know. And I purposely made sure that each of these terms relate to the other terms so that you have a bigger base of background information to start from as you continue to learn about all of the reading terms and words and acronyms that every caregiver and every person who is aging should know. So, if you've not been on my channel before, I'm Pamela D Wilson. I'm a caregiving expert, advocate, and speaker. I help aging adults and caregivers work through all of the issues related to caregiving. Health, money, legal aspects, family relationships, navigating care communities, working with doctors, all of that. You can learn more about me and my almost 25 years of experience by scrolling below this video. There are links to my website, my bio, ways to schedule a one-on-one consultation with me. If you are a return visitor to my website, I thank you so much. I welcome you back, and I really do appreciate your continued support and interest in continuing to learn about caregiving and aging. Please do like this video, follow my channel, share these videos, and comment even if it's only to say thanks for the video. One little thank you, that moment that you take to do that, makes a difference for people all over the world. It helps them find these videos. So let's start with the 10 reading terms, words, acronyms that every caregiver and aging adult should know. The first one is ADL. Apple, Dog, Larry. It's activities of daily living. You're going to hear doctors talk about this, nurses talk about this, home care agencies, care communities, nursing homes. Activities of daily living are things that you and I do today that we take for granted. We get up, we take a bath, we take a shower, we wash our hair, brush our teeth, put on some makeup, put lotion on, trim our fingernails and our toenails. We go to the bathroom, right? We use the toilet. We prepare meals, we eat. We get dressed. We stand up out of a chair. We get out of bed. We get in and out of our car when we go places. We move about. These are all things that when we're young and healthy, they are so easy to do. But when people get into their 60s, 70s, 80s, 90s, and their body is not physically strong, doing these things that we take for granted today become a problem. ADLs, difficulty with performing ADLs, are the number one reason, besides a health diagnosis, that your parents, that aging adults, that grandparents, and other people need caregivers. The number one reason that they need help. Number 2, IADLs. So take the ADL, put an I on the front of it. Instrumental activities of daily living. These are other things that you and I do today. We take it for granted. It just is part of our daily life. It's things like we have a job, we work. We have income. We pay bills. We manage money. We decide how to spend it. We get our mail. We open all those envelopes. We look at them. Is it junk mail? Do I need to pay this bill? Do I need to do something about this? We use the computer. If we have any health problems or if we're healthy, we may take some vitamins. We may have some medications that we take. We may organize those into little boxes. We pick up the phone. We call people. We cook, we clean our house, we do laundry, we drive, we use public transportation. All of these things that we do in our daily life. ADLs, number 1. IADLs, number 2. And again, problems with either of these, in addition to health problems, are the reason that people who age start to need help from their children. So, if you are an adult child, and you see your parent and they're starting to have difficulties with these ADLs and IADLs, pay attention. Warning signs should be going off. Ask your parents what's going on. Why are they having more difficulty? What kind of help do they need? Because the goal is you want your parents to be as independent as possible, as long as possible. Otherwise, you become their caregiver, and then you start doing more and more and more. And if you're here watching this video, you probably already know that. Number 3 in the words that caregivers need to know. LTC. Larry, Tom, Charlie. It stands for long-term care. Long-term care can relate to care in a nursing home where people may live for the rest of their life. Long-term care can also relate to a term called HCBS, Home and Community-Based Services, which is a service provided by a state Medicaid agency. So who needs LTC? People who need LTC are people who are having significant problems with, number 1, ADLs, and number 2, IADLs. So people who are unable to perform these daily activities, people who have a lot of health problems, people who have memory loss, may need LTC, long-term care. Long-term care, again, is care in a nursing home or care in the home paid for by Medicaid. Now, a related acronym, I'm going to throw in a bonus one here, to LTC, put an I on the end, LTCI, long-term care insurance. My recommendation, get it if you can. If your job offers long-term care insurance, purchase it individually. It's a voluntary type of insurance. Most people don't realize that they're ever going to need LTC, right? Because we're all healthy and we're all going to live forever. So we're never going to have problems with ADLs, IADLs, and we're never going to need LTC. Well, that is faulty thinking. All of us as we age probably are going to have problems with all 3 of these things. So the LTCI, long-term care insurance, pays for the costs of care like in-home caregivers and going to a nursing home for long-term care. And it pays for other things, assisted living, memory care. Now, why would you need LTCI? Well, it's because Medicare does not pay for everything. I know it's a shocker, right? When you're over age 65, you think the government and Medicare is going to take care of everything. Not so. You pay for costs of care before you get to a point where you need LTC, long-term care through Medicaid, which means basically you spent all of your money, you're at the poverty level, you need care, and you can't pay for it. So, major tip, if you have not saved for retirement, if you've not considered buying long-term care insurance, think about it now. There are actually 3 states that are working on mandatory long-term care insurance deductions from your paycheck. State of Washington, state of Oregon, actually 4 states, California and New York. Why? Because it's getting to be so expensive and the government cannot keep paying for all of this. The reality is that health can get worse with age. Healthcare is expensive. You know this. If you don't go to the doctor because you're worried about having to pay a $25 premium, or you don't get a prescription filled because you're worried about the prescription cost, or you don't go get your teeth cleaned because you don't have dental insurance. Taking care of your body and your soul is expensive. LTCI can help pay for care when you're older. Number 4 term that all caregivers and aging adults should know. SNF. S like Sam, N like no, F like fun. Skilled Nursing Facility. SNF. This is the place that you or an elderly parent go sometimes after a hospitalization. So maybe a parent has broken a hip or broken an arm, or maybe they're having surgery. So you go to the hospital, you're there for a couple of days, and then you need a little more help, so you probably can't immediately go home because maybe you're too weak to care for yourself. The surgery has made you not feel well. If you're an older adult and you've laid in a hospital bed for 3 days, you may not be able to do all the things you used to do. So, Medicare or your Medicare Advantage plan covers the first 20 days in a skilled nursing facility. A skilled nursing facility is the same thing as a nursing home. It's the same thing as rehab. It's just another acronym. Now, few people I know want to go to a nursing home for rehab, but think about this. It can really be a place to get better and to get stronger so that you can avoid going back into the hospital, which people don't want to do, and you can avoid going back to a SNF, skilled nursing facility. But the thing is, you have to work at becoming physically stronger. That's why people go to a SNF. And that means that you will participate in things like PT, physical therapy, OT, occupational therapy, and ST, speech therapy. I'll talk more about PT in a minute. Number 5, in the words and terms and acronyms that caregivers and aging adults should know, POA. Purple, orange, apple. POA, power of attorney. Power of attorney. It's an estate planning document. A power of attorney agent is a person, a family member, a friend, a professional that you choose to help you make medical and financial decisions when you no longer can do that. We all need a POA. Doesn't matter if you're 21 or 81. Unexpected things happen. Car accidents. You get hit by a bus. You fall down the steps. Some accident happens, right? And you go into the hospital, and maybe it has affected you mentally or physically. And the doctors are asking you to make all these decisions and you don't feel comfortable making them because you're thinking, gosh, I don't feel well, my mind's not thinking right. This power of attorney agent that you appoint can actually help you with that. There is an entire program on my website, PamelaDWilson.com, about power of attorney, and there's lots of videos here on YouTube if you want to learn more. If you are applying for LTC, long-term care, if you are going into a SNF, a skilled nursing facility, it's really helpful if you have appointed someone as agent under medical and financial power of attorney who can help you with all the details and all the paperwork, because there is a lot of paperwork. Term number 6, PCP, Paul, Charlie, Paul, means primary care physician. We all need one. We all should have one, but not everybody does. A PCP is the primary doctor that you go to for all your health problems. Now, if you're older and you have other health problems like heart problems or diabetes, you may see a specialist, a cardiologist or an endocrinologist. But the PCP is the person that you go to when you wake up and you don't feel well, or you need an annual checkup, or maybe you need something else. That's the person you see. Now, if you don't have one, you may be like, well, I'm healthy, I don't need to see a doctor. Well, I will tell you, it is good to establish a relationship with somebody that you see at least once a year for a checkup, so that if something unexpected happens, you're not saying, oh my gosh, I don't have a PCP, and then it takes you 6 or 8 weeks to get in. It's good to have somebody to see in the event of an emergency. It also can prevent you from having to go to those doc-in-the-box clinics on the corner where the doctors don't know you. And yeah, you can go and get treatment, but wouldn't you rather have somebody that you have a relationship with, who knows you, that you trust? It makes a big difference when you're receiving medical care. Number 7, UTI, under, train, invisible, urinary tract infection. Urinary tract infections, oh my gosh. They happen a lot in women, but more commonly in elderly people who have a couple of things going on. Alzheimer's or dementia, multiple health conditions like high blood pressure, diabetes, kidney disease, depression. Men who have an enlarged prostate gland can have more urinary tract infections. People with a poor diet, people who are dehydrated, who do not drink enough water. Older people usually do not drink enough water and do not drink enough fluids. Why? Because then they have to go to the bathroom all the time. That's exercise, right? That keeps you healthy. Getting up out of the chair to go to the toilet is exercise. Being dehydrated and having poor nutrition can cause urinary tract infections. So for older people, urinary tract infections can be part of the spiral that's called failure to thrive or metabolic syndromes, where elderly people who have a lot of health problems, their health just gets worse and worse and worse and worse and worse, and they get sicker and sicker and sicker. The best way to avoid urinary tract infections is to create a bladder and a kidney health maintenance plan. Drink water. Process all of those toxins out of your body by peeing a lot, right? And if you're in doubt about all this, go see your PCP. If you're even in more doubt, go see a urologist or a urogynecologist. These are specialists who deal with frequent urinary tract infections. They also deal with urinary incontinence. If you're leaking or having bladder problems, they can help you with those things. UTIs can be a problem when we become older. Next on the list of words, acronyms, and terms every caregiver and every aging adult should know. Number 8, DNR. Do not resuscitate. This is usually this bright green piece of paper that has a list of questions on it. It's two-sided. You fill it out at your doctor's office. And it confirms whether you want to be resuscitated. Well, what does resuscitated mean? It means that your heart is no longer beating and you're not breathing, which technically means you're dead, right? So if you're dead, do you want somebody to bring you back? Now, there's a lot of circumstances. Some people get struck by lightning. Their heart may stop. They may be 20 years old. Probably if you were 20 years old and healthy, you'd want to be brought back if you could. But when you're older and you have a lot of health problems, you have to really think, if I die, right, my heart stops beating, I stop breathing. If I die and somebody brings me back, am I going to be better than I was before I died for a couple minutes? That is a huge consideration, because when your heart stops beating and you're not breathing, you're deprived of oxygen. Your brain needs oxygen to function. Do you want to come back and be not at the same level you were before? Be more forgetful, have some brain damage. Maybe it affects parts of your bodies. A DNR is something very serious to think about. And a DNR works with a living will. It's also important that that person that you appointed as your PLA, that term we just discussed, knows exactly what you want. Do you want to be resuscitated or not? How much extensive care do you want or not? If you can't tell somebody. Very important. Number 9, BM, bowel movement. This one is simple. Daily BMs are good. Constipation, bloating, not so good. Older people get constipated a lot. Why? Because they don't drink enough water. You have to have water to flush all of that food out of your body. You also need fiber. Fiber helps process all the stuff that you put in your body out of your body, maintaining a healthy tummy, a healthy gut. And a well-functioning digestive system is very important for all aspects of your health. A lot of older adults worry about having BMs. It's really quite simple. Drink a lot of water, at least 64 ounces a day, unless you have a health condition that says you shouldn't. Eat a cereal like Bran Buds every morning. Eat some oatmeal. Eat fruits that are high in fiber. An apple a day keeps the doctor away. It also keeps your digestive system working smoothly. On the drinking water front, let's go back to that one again. If you don't drink enough water, you're more likely to get the UTI. So, all of these 10 terms that I'm sharing work together with each other. I've purposely grouped them so that they make bigger sense in the bigger scheme of things. Now we're down to number 10, the last one. PT, physical therapy. If you've had a sports injury, if you're an older person, if you've had any type of injury, like you walk down the curb and you turn your ankle, wow, that hurts a lot, right? Or if you're just physically weak, your balance isn't good, your gait, the way that you walk is uneven, you have some soreness here, you got some weak muscles. A regular program with a physical therapist is worth its weight in gold. Why? Because if you have physical problems, physical disabilities, what can't you do? You can't do number one, and you probably can't do number two. What were those? ADLs and IADLs. Then you're more likely to need long-term care, end up in a skilled nursing facility, need a POA. See how all these terms relate to each other. A lot of older adults, your parents, they have poor balance, they fall all the time, they have difficulty getting up out of a chair. Can you stand up out of a chair without your arms, right? Being unable to independently perform your ADLs means you're probably a candidate for physical therapy, but you need an order. How do you get it? Guess who you get it from? Your PCP, your primary care physician. You have to go actually see them and tell them the problems that you're having physically. Then they can give you a prescription or an order. Then you can go to an outpatient physical therapy clinic, or if you're older and you're homebound, the physical therapist can come to your home, probably along with an occupational therapist and maybe a speech therapist. The goal here is to make sure that you can continue to do your activities of daily living without help from anybody else, and that you're physically strong, you have some muscles, you have some physical endurance from your heart level, you have good balance, you're not going to fall. So the goal of physical therapy is to regain physical strength and endurance and balance. It's a commitment, right? It's a commitment to go see a physical therapist. It's a commitment to say, you know what, I'm going to do these exercises every day, and then I want more so I can become stronger. One of the main reasons older adults go into a SNF, skilled nursing facility, after a hospital operation or an accident is for PT. So the best advice I can give you is to learn all of these 10 words, acronyms, terms, whatever you want to call them. Learn how they relate to each other. Learn the importance of staying physically active and strong so you can do your ADLs and IADLs. If you have an injury, go get physical therapy. And keep working on all of these terms. There are probably another 20 or 30 terms I can share with you, but these are the most basic ones that relate to aging, beginning to have health problems, needing a caregiver, going into the hospital, paying for care, and then being unable to pay for care. I thank you all so much for being here. I'm Pamela D Wilson. I'm a caregiving expert, advocate, and speaker with almost 25 years of experience. Information about me is below this video, my bio, my website, ways to schedule a one-on-one consultation with me, free education programs on my website, my podcast, my book, everything. Please do like this video, follow my channel, share these videos, and say thank you, even if that's the only comment that you make. You're welcome to share your stories too. But one thank you goes a long way in helping other people find their way here. I'll see you all again soon in another video. 23 minutes.